Hello friends, in this video we will talk about the anatomy of the humerus bone. So starting with the facts about the humerus. जो humerus है, it is classified as long bone. Since there are many types of bone, long bone, short bone, circular bone, so this sesamoid bone, so this is considered as the long bone and it is the longest bone in your arm. So when you hit your funny bone, you're not hitting your humerus, you're actually hitting your ulnar nerve which is located behind your elbow joint. So bone in your arms or hands are more likely to be broken. This is because of fall or reduce of impact of some kind of trauma or blow. We will now read the parts of humerus, which is head, tubercle, surgical neck, epicondyle, trochlea, capitulum and fossa. इन सब के बारे में वी विल रीड इन दी फर्दर वीडियो एज विल प्रोसीड. सो जैसे हेड, ट्यूबरकल एंड सर्जिकल नेक है, दिस इज़ द अपर एंड में पाए जाने वाले हैं, एंड ट्रॉक्लिया, कैपिटुलम एंड फोसा इज फाउंड इन द लोअर एंड और वी कैन से द proximal and distal ends of the humerus bone. Now moving towards the functions of the humerus bone. सो बेसिकली इसके मूवमेंट्स जो होते हैं वो हर तरीके की मूवमेंट्स ये परफॉर्म करता है, लाइक रोटेशन, एबडक्शन, एडक्शन, एक्सटेंशन एंड फ्लेक्शन. व्हाट काइंड ऑफ रोटेशन इज ऑफ द shoulder joint, and we know how is the rotation goes on. Raising your arms away from the body is known as the abduction, that is away from the body. So here this is going, the arms are going away from the body. Now lowering your arms back toward your body is adduction. मतलब add करना है, this is to add. So here the arms are moved back towards the body. Now moving your arm behind your torso is known as extension. When we move your hand behind our body, behind our torso, so that is the extension. And just opposite to this movement of arm in front of your torso is the flexion. Straightening of elbow joint is known as extension also, and bending your elbow is known as flexion, as this is known as the flexion, bending of the elbow. Now moving on, we will study the upper end of the humerus. So this is add, this is extension, flexion, again extension is straightening, again flexion is bending. So the upper end of the humerus, consists of head. This faces medially upward and backward. Head is separated from the greater and lesser tuberosities by the anatomical neck. I will explain you through the diagram what is the head and where is anatomical neck, and where these rotator cuff muscles, that is suprainfinitus, infraspinatus, teres minor and the subscapularis all gets attached. I'll show you it through a diagram. So the three this rotator cuff muscles attaches in the greater tuberosities, and the last rotator cuff muscle, the subscapularis, attaches in the lesser tuberosities. So separating the tuberosities is there is a deep groove known as the intertubercular sulcus. So between the two tuberosities, it is separating through anatomical neck and through intertubercular sulcus posteriorly, while anatomical neck in the anterior direction. So now we will remember the name of the four rotator cuff muscles, which is very important according to the examination point of view. So this is supra, infra, what? Spinatus, teres minor and subscapularis. So supra, infra is common, you can learn it as it is supra-infra, annus, teres, minor, and subscapularis. Now moving ahead, the edges of the intertubercular sulcus is known as lips. जो इंटरट्यूबरकुलर सर्कस जो दो ट्यूबोसिटीज़ के बीच में पाए जा रहे हैं उनको लिप्स कहते हैं. एंड द पेक्टोरालिस मेजर, द टेरिस मेजर एंड द लैटिसिमस डोर्साई इंसर्ट ऑन द लिप्स ऑफ इंटरट्यूबरकुलर सर्कस. मैं ये आपको इमेज में दिखाऊंगी वेयर इट गेट्स अटैच्ड. फर्स्ट ऑफ ऑल वी विल अंडरस्टैंड दी anatomy what we had read till now. So this is the anatomical neck which is separating the greater tuberosity and the head. Okay, posteriorly as you can see here is the intertubercular groove which is separating the greater and the lesser tuberosity. So this is now is a surgical neck. On the posterior face of the humerus, this is the deltoid tuberosity. On the lateral surface of the humerus shaft, which we will study later in this video. So deltoid tuberosity और जिसमें deltoid muscles का they get attached. So this is found on the lateral surface of the anterior face of the humerus bone. It separates the this greater tuberosity and the lesser tuberosity. Intertubercular groove. Yes, so this is tuberosity. Now moving ahead, we will read about the shaft. What are the so shaft, it's a site of attachment of various muscles. About 13 muscles get attachment over here, some of origin and some of the insertion. On the lateral side of the humerus shaft, it is roughened and is known as deltoid tuberosity, जहाँ पे deltoid muscle attach होता है. As you can see here, as I already told you, it's rough and the deltoid muscles get attached here. Now the laterals of this supraepicondylar ridge on the distal end, supraepicondylar ridge is found, and there are two epicondyles, one on the medial and one on the lateral side. So medial side is a little bit larger extended and lateral epicondyle is rough than the medial one. Now the lateral supraepicondylar ridge is a site of the origin of extensor muscles. I will show you through a diagram the muscles origin, insertion, everything. So the medial end is larger, trochlea is located medially and lateral is the capitulum. See, this trochlea is located medially and capitulum is lateral to the trochlea. It gives attachment for the elbow joint formation. Which fixes the ulnar notch. Now we have olecranon fossa on the posterior aspect of the arm, which is humerus bone. It provides the elbow flexion. Now in the distal end of the humerus we have three fossa, two condyles, which is the lateral and the medial epicondyle, and one is the trochlea and another is the capitulum. What three fossas we have is the olecranon, coronoid and the radial fossa, all for the attachment of the elbow joint during flexion. Trochlea and the capitulum is lateral to the trochlea. So this is the distal parts of the humerus bone. Now understanding the articulations of the Humerus bone. The proximal region of the humerus articulates with the glenoid fossa of the scapula to form the glenohumeral joint or the shoulder joint, and distally it forms the elbow joint through the attachment of capitulum with the head of radius and trochlea to the trochlear notch of ulna. Now, how will you determine the side of the humerus, which is the 2 marks question in the examination, the side determination of the humerus bone? So we will see 4 parts. The upper end upward, head is directed medially, intertubercular sulcus anteriorly, and fossa is posteriorly. Now when you hold humerus in anatomical position, the head will be directed upward, medially, and little backward. So the diagram of the humerus will look like this: upward, medially, and little backward. This is the head. Now the muscle attachments of the humerus bone. So the muscle attachment we have like deltoid tuberosity. The muscle attachment is deltoid ka origin is there. The blue one is origin, and the blue one is insertion, and the red one is origin. So the deltoid tuberosity has its insertion at the humerus ka lateral surface पे. Okay, next is the coracobrachialis, which has its insertion in the shaft region. So these two, deltoid and the coracobrachialis muscles, are in the shaft region. Now moving ahead with the origin, at the distal end of the humerus we will have all origins. Origin of brachialis muscles, brachioradialis, pronator teres muscles, common flexure origin, as you can see. So all the movement kinds of muscles like pronator, flexor, extensor, carpi extensor, common. So these are all found in the as a origin in the humerus ka distal part mein. Okay, and the brachialis and the brachioradialis. This is extensor, flexor, and pronator. All 3 kinds of movements or muscles are found having origin in the distal end of the shaft. Now moving ahead, we will discuss some important muscle attachments of the upper end. Learning it as a trick, we will memorize it, how these are having their insertions. So understanding, now as you can see here, we have supraspinatus muscle, subscapularis, latissimus dorsi, teres major, pectoralis major. So we have 5 muscles in the anterior part of the upper end, on the anterior part of the upper end. So now we will discuss about the 5 muscles are there, as we have read 5 muscles which are like this: rotator cuff के 2 muscles, supraspinatus and subscapularis, and rest is the intertubercular groove के जो muscles attach हो रहे हैं on the anterior aspect, which are the pectoralis major, latissimus dorsi, and the teres major. These 3 muscles lie parallel to each other, having their insertion on the upper end of the shaft of the humerus on the anterior aspect. Okay, so 2 rotator के हो गए and 3 parallel, pectoralis major, latissimus dorsi, and teres major. Okay, now next what we will study is the posterior aspect में कौन कौन सी muscles हैं. So it is very easy. Posterior aspect में we have deltoid, okay, on the lateral surface. Rest is the तो रोटेटर कफ की 2 मसल सुप्रास्पाइनेटस एंड सबस्कैपुलरिस एंटीरियर में है, तो बाकी 2 इंफ्रा स्पाइनेटस एंड टेरेस माइनर पीछे पोस्टीरियरली दे आर अटैच्ड. ओके, नाउ लेटरल हेड में and medial head of triceps, these are having origin on the posterior aspect of the humerus bone. On the posterior aspect we have lateral head of triceps and the medial head of the triceps. So it's very easy to learn the 5 muscles, only 5 muscles we have to learn. Rest is all the flexor carpi supinator econeus. ठीक है. सो 2 रोटेटर के आगे हैं, 2 रोटेटर कफ के पीछे हैं, विच इज़ इंफ्रास्पाइनेटस एंड टेरेस मेजर माइनर. ओके, सो या दिस इज़ ऑल अबाउट the video. Thank you, and do like, share, subscribe my channel for more such videos which I'll upload about the anatomy of the bone and all.